have one responsibility. I mean, it's not their fault. What is their legal, their legal necessity is to make money for their stockholders. Now, in the U.S., we have a corollary to that, which is also the executives want to stuff as much money in their pockets as possible, as quickly as possible. So the greed that destroyed all of our retirement funds is very much alive in the insurance industry. United Healthcare, which controls hundreds of millions of dollars in New Mexico public monies for healthcare. And they're a big insurer here, and they control mental health and substance abuse money. They're a major player. United Healthcare in 2004 paid their CEO $1.4 billion. Billion. So is this, and when they caught him then manipulating his stock prices, and they gave him the largest golden parachute in history. I mean, he should have been Bernie Madoff's cellmate, right? Instead, he got the biggest golden parachute in history. So, I mean, can we really keep these insurance companies central in a healthcare system that meets the needs of the American people? And, you know, I'm sure I know there are models over in other countries, but, you know, we don't have the ability in this country to control Wall Street, and we haven't shown the ability to control the insurers. And I'm really skeptical that we can, even if they had wanted to regulate them, that they could actually control that kind of greed. But I know that's not the last word, so your turn.
Let me see if I can, I feel like I'm a mediator here. Because you two truly have done years and years of work, as most of this room, thinking about this stuff. I just want to remind us that we have to really put on our thinking caps for another 25 years to get to resolve it. The argument for single payer is valid, and it is the only argument. It is the system that we need in this country to get to where we need to be as a society that says it is equal and cares about fairness and compassion. There's no argument about that. Rick Scott is the man that you were just talking about who got the golden parachute.
No.
No?
It was William McGuire.
William McGuire. Well, Rick Scott, who's heard of him? Anyone? He's another healthcare executive. He is now spending $1.4 million a day directing the campaign to SwiftVote, the public health option. We don't even have the bills solidified on this yet, and yet $1.4 million a day is being spent to design campaign ads to SwiftVote, the public plan that doesn't exist. So I don't think we can afford to jump across that abyss, and that is a debatable point that I hope we all debate. Because if we fall, we are risking a lot. We're not just risking our lives, but we're risking people's lives. I want to also just remind you that Bernie Sanders, the author of Senate Bill 703, supports the inclusion of a strong public plan. He signed on to what is known as the Sherrod Brown letter, which is a letter that says, you know, the stakes are too high to turn our backs on a strong public plan right now. Bernie Sanders is the author of the Holy Grail, single-payer health bill. Okay, so this is how high the stakes are. These are not competing philosophies. This is hopefully a discussion of how we leverage our movement to get to where we need to be.
Tactics.
Like if you want to ask a question, stand in line and the first person can ask the question and then give it to the...
Well, I have a question. I've got a comment. First of all, it's an awfully well put together panel because all three of you I completely agreed with, and I didn't think that was possible. So, I've been, for about 35 years, I've been fighting this battle as a clinician, and certainly not all clinicians are trying to just get rich. I know that Bruce is probably very rich, but
He's an exception.
He's an exception. I'm a nurse practitioner and a nurse midwife, and I've worked in indigent care and Indian care ever since '77. But I would really just like, as far as tactics, one tiny point that I know we could do here tonight and everybody would agree on. Let's stop talking about coverage. Let's get that word out of our discussion. because it means nothing, because I can tell you after 30+ years of doing this work, it means nothing. So let's talk about health care, and that gives us a chance to get into some of the details of whether it makes any difference or not what we're talking about, because coverage is a sham word, as far as I'm concerned, the insurance companies.
I think we have to have a big vision and big action. I think cherry picking at those tiny things is not going to solve our problems, so it's bold. My question is, how do we, the people, have honest representation in Congress from representatives that are bought and paid for by the healthcare industry, by insurance companies, by pharmacists, the pharmaceutical companies? It's not fair. There's a complete imbalance of representation between the people and the industry. How do we compete? It's almost unreal. And I grew up in Britain in the public health care system. And it is true, everybody now is in private patients or Bupa, but they're there because the system was poorly funded.